Actions speak louder than words. And today, while we're talking about making children healthier, there's a way you can make it happen. The Royal Children's Hospital Foundation supports research, education and expertise that impacts generations of children. And with generous support from the Good Friday Appeal, together they make this podcast possible. Every single dollar is an investment in healthy children. Search the Royal Children's Hospital Foundation to show your support. Hi, I'm Dr Anthea Rhodes, paediatrician here at the Royal Children's Hospital Melbourne, and your host today on the Kids Health Info podcast. In this episode, we're going to be talking about autism and addressing lots of the common questions that parents have about this condition. And here to talk through this with me is one of our psychologists, Dr Toby Rheinberger. Welcome, Toby.
Hello, thank you for having me, Anthea.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So good to have this chat today. We hear about autism so much in our community, which is really great that it's up and being talked about in conversation. Perhaps you can start by telling us about what it actually is.
I can try my best. I think if you spoke with lots of different people, they'll give you different definitions. And I noticed at the start you said autism, and maybe some listeners will be thinking, wait, is that the same as autism spectrum disorder? The answer is yes, and the way lots of members of the community prefer it is by saying something called autism. If we look in the book what we diagnose people with, it's a way of describing people who have differences in the way they form social connections and understand social relationships, and differences around the way they like their days going. So usually a preference for sameness and differences around the way they process sensory information. So those are the two bits. And I deliberately chose the word differences rather than deficit because it's a difference compared to the general population or allistic people without autism, and not necessarily a deficit or a bad thing.
And that difference may in fact mean that you can do things in a way that's preferable for you, but not necessarily a deficit.
Correct. And it means that the hard part sometimes comes from the differences interacting with people who don't have those same differences, which is called the social model of disability. So for me, someone who might have autism, there's a strong preference for sameness, so I like my day going the same way. Same days can't always go the same. People without autism are like, oh, it's okay to be a bit flexible, but for someone with autism, it's very distressing, and the distress comes from not going according to their schedule. So if we all ran 100% to time, all of it, there would be less difficulties.
Less challenges emerging.
Less challenges, that's right.
Okay. And perhaps it might be good to talk about the language that we use when we're talking about autism. So you've mentioned autism spectrum disorder and autism as a diagnosis. What about how we refer to people who might have autism?
Yes. So there's differences around how the community refers to them. So most people would prefer what's called a person-centred diagnosis. So it puts the person at the centre. So that's a person with autism. Other people prefer to frame the diagnosis or the disability first, which that's someone who is an autistic person. So it might be Jill has autism or Jill is autistic.
Okay.
We're going to go today just from preference and what I understand from the community with person-centred, so we'd mostly be saying people with autism, acknowledging that there are members of the community who prefer it another way, but we've chosen to do this just for today.
Great. And of course, when you're dealing with individuals, it's always best to see what their personal preference is.
Yes.
And do your best to stick to that in the way that you refer to the condition and individuals.
By asking, and maybe not that person-centred, disability-centred, it's just like, how would be the best way for me to describe your presentation today?
Fantastic. Okay. So perhaps we can talk now a little bit about how autism might show up, if you like, in an individual or in the way they're navigating the world.
Yes. So I think lots of time people might bring to mind that really older archetype of autism where it's a young person sitting in the room who becomes very distressed at small changes in their day if their meal isn't arranged in a certain way on their plate, which it can be. I think red flags or ways it might show up in the room is difficulties or differences navigating the social environment. So this might be differences in the way they make friends or introduce themselves to people, a bit unsure how to approach people and start conversations off, or needing older people's support, gravitating to younger or older peers who can help guide the social interaction, or in a conversation needing the support of others to keep it going, even though they feel really interested in it or seem really interested in it. The second part, which relates to the preference for sameness or the predictability and routine, is if there's changes in the day and the young person becomes upset or really distressed, if you notice that there's certain differences in the way they process information. So I often think around difficulties with you go to the haircut and they're really upset when they get their haircut and this lasts across time, or if they are their preference for thinking is often black and white, or they like enforcing the rules, there's a right way or a wrong way, and it's that rigid brain style. So some examples of some rigid thinking or black and white thinking is if you think around Uno or card games like that, most families have slightly different variations of the rules. These young people might find it really difficult to transition to a different rule set, even if it's a small change, and they'd make it quite clear that, no, this is the rule, this is the way we go. Predictability for routine, I often think around at school is if the teacher suddenly or unexpectedly changes, getting very upset with that, or if usually we do dinner and then shower, if whatever reason we did shower then dinner, and that just doesn't feel right, can be a period of distress. And listening to teachers and friends around how they're going and connecting with their peers, so starting conversations off, participating equally in conversation, or if they might be dominant in a conversation, or just kind of float around on the edge and seem a bit unsure about how to start it off.
Okay, so lots of different ways that might be small, but I guess can all kind of add up together to give that picture of some of those differences that might result in a challenge navigating some of those typical situations in day-to-day life.
That's right, and most of us might do one of those things every now and again. We all often think around preference for sameness. We all have routines. Our jobs usually start at a specific time. We have to be up at a specific time. So we feel distressed if we're running late. Yes, this is usually bigger than that, and it's across time, and it's in combination, as you said, with all of those other things. So one of these things is I wonder what that is. If it starts being the picture altogether, that's when it could be worth following up with your local doctor.
And how might it be different, I guess, at different ages and stages, Toby? So there might be people listening with quite a young child, perhaps, a toddler, a 2-year-old versus a teenager. How might these challenges emerge? There's
key kind of markers where we see that young people are identified with autism, and it's usually the transition into prep or primary school, transition to high school, or later on for other adolescents as they're kind of entering university, because these are big markers. I think it's thinking around what's the social demands and what usually goes on. So in primary school, often parents and caregivers are very responsible, so they organise the play dates, and thinking around, does my child get invited to play dates? Do they seem interested in play dates? Are they asking me? And around what that is. As young people get older, the conversation tends to shift to being more the individuation stage as teenagers become more independent, and it's them seeking it out themselves. So the differences might be getting into fights with their friends more, kind of isolating themselves. And typically it's that high school transition, and I imagine we'll talk around girls again in a bit, but the transition from running around playing Tiggy and monkey bars to suddenly having those structured conversations. So when there's rules with Tiggy, like I know where run, I'm okay. But when it's this free-form conversation, I'm less sure.
So as those, if you like, social demands get more complicated or more complex as young people grow up, the challenges might become a bit more obvious.
More clear. And thinking around the level of support that someone might need. So young people with autism require different levels of support, and these are what the levels that people refer to. So it's requires support, requires substantial support, requires very substantial support. Young people with different levels of support it will become clearer later on as the demands outstrip the level of support that they needed, if that makes some sense.
It does. And perhaps we can just talk briefly about what that support might look like.
Yeah. So support can look like two parts, because there's the differences in engaging socially, and then there's the differences that result from preference for sameness and predictability for routine. So the support that might be required around social interaction is in a conversation, another person asking questions or helping keep the conversation going, or helping them introduce themselves or talking around topics. With the predictability for routine, it might be practicing routines, ensuring that we know around sensory sensitivities, and knowing that these young people, it's not so much a choice. It's if I wear this thing, it makes me really uncomfortable and I really don't like it. And I sometimes tell parents or caregivers that lots of people have these sensory sensitivities as well. If you go into a shop, you'll notice people as they go through, you touch clothes, and there's certain ones you're like, no, I can't wear that all day. And that's true, and then magnify that lots and lots and lots. And that's what a sensory sensitivity might be like.
So accommodation for some of those differences is part of the approach to providing support.
Yes. That's right.
So one of the things that we've found really helpful on this series in the podcast is hearing some questions from our listeners.
Okay.
So our producer, Grace, is going to read out a few questions for us now that have been sent in through the social media channels, and we're going to chat about those together.
This first question comes from Danielle, and Danielle says, I have a 6-year-old daughter who masks all day at school. It's a real challenge to get her ready for school and after school. Is it a good thing that at least she's functional at school, or is this causing more fatigue overall?
It's a great question, and thanks, Danielle, as well. I think it's important we start with maybe for people who aren't familiar with what masking means. And masking refers to individuals with neurodivergence or even just mental health conditions or life more broadly, where I put on a mask and act as if I don't have the condition. So in autism, what this might look like is engaging in small talk where realistically that doesn't really interest me, pretending that those small changes in routines don't really bother me, whilst on the inside it feels like it's ripping me apart. So parents will often say, my child is fine, and then they get home and then they all fall apart because all of the concentration has gone into doing this. And the question related is that a good thing that at least she's functioning at school? And I think it's awesome that it shows that, yep, she can do things at school. I think what it means, though, is we do need to think around what goes on at school to make her feel supported, and having spaces where the mask can come off a little bit and we know that that's okay. But often young people, particularly girls, feel that they have to act this way, otherwise there'll be consequences. So telling someone just turn off the mask is much more challenging as well. So it can just be like, what's a way that we can support your brain to feel as comfortable as it can be?
Yeah, that's really interesting. Great explanation and really helpful advice. And it's that idea of compensating, I suppose, all the time. And as you say, there's an impact from that. There's some good outcomes, and we all compensate in different ways for different things.
Exactly.
But it's that fatigue that is a big part of the challenge.
The fatigue is certainly a big part of the challenge, and it drains someone's battery. So often they're very tired and need some recharging time, and that can sometimes what it be is afterwards it's just like what's ways to charge your battery back up or fill your cup. Is I often think about those times when you're really tired, when your baby was really young and you weren't getting any sleep whatsoever, and maybe you needed to rock up to work or see your friends, and you can't say, oh, I'm really tired, so you have to pretend, and you go really pep and really excited. And that's what it is. It's like that masking me saying, oh no, everything's fine, and then you go, ugh, I'm really tired. It's the same
and it's
kind
that
of thing.
day in, day out.
Day in, day out.
For often really little people
really long
dealing
time.
with lots of big challenges.
Yeah. And I think there's one part of masking which is camouflaging myself among other peers, but differences can sometimes be camouflaged by society as well.
I think that leads us really nicely into the next question.
Thanks, Anthea. This next question is from Tammy, and Tammy wants to know, what are the distinct signs of autism in girls? Are the signs different in boys and girls?
I think it's worth like a brief kind of history lesson around how diagnostic criteria developed, and it's developed from lots of people sitting together, reading studies and saying these are the features that go with these conditions. So if we move away from neurodivergence and think around another mental health condition like anxiety, experts sit together and be like, these are the criteria for anxiety based on prevalence studies. They do the same things with neurodevelopmental conditions like autism. Unfortunately, because the way the world has worked and these criteria have developed, the developers of the criteria early on focus more on boys, and the studies initially just only include boys. So the way we're describing it is focused on a boy definition rather than an all people definition. So
it's biased, if you like, to begin with.
Biased to begin with. Great way of putting it. And the way around girls, it presents the same as boys. The criteria is the same, is differences in social situations. What I often think around, though, is some differences can be around restricted or very strong interests or fixed interests. In girls or female identifying people, it's usually more quote-unquote socially appropriate. So it might be friendships or movies or TV shows. And I often think around, people can be interested in it. It's the level of intensity is higher, and their presentation changes when they talk around it. So I know a young person who their topic of interest is clowns, and when you start talking about clowns, this young person gets very excited and likes talking about the details. Girls as well, typically, just the way around society, often have higher levels of masking behaviour. So lots of people with autism still are very interested in connecting socially with peers. It's just the way they go about it is different. More girls would be socially motivated. They're keen to connect. And I ask parents they're often the floaters on the edge of a conversation, not quite sure what to do is another thing to look out for, and often very anxious and internalised at this masking thing. So summary answer is much the same, and there are some subtle differences as well.
And I just want to pick up on something that you said there, which is around, seeking that social interaction and that peer-to-peer interaction. I think one of the myths or misunderstandings we hear about often in the case of autism is that there's a preference for being alone or that people with autism don't actually want to have that social interaction.
Yes, and that's a myth. Some people with autism, their brain is motivated that I feel comfortable being by myself, I feel comfortable alone. There's lots of people with autism who are really keen to make friends, and they're trying and they're doing it. It's just the way they're doing it is differently. So I often think about small talk and follow-up questions when you're politely in the elevator with someone from work. How was your weekend? Those kind of questions I'm less interested in following up on. Instead, I'm more interested in engaging around my interests. And if we engage someone with autism around their interests, the conversation flows really, really well. And people who are less socially motivated still will prefer connection. It's not like they want to sit in the room. They still need to feel the love, care, attachment, and security from caregivers. It's just the way they show it is different and express it is different, but they still feel those things.
Absolutely. On to the next question.
Thanks, Anth. Our last question comes from Beck, and Beck says, my child's kindergarten teacher has mentioned she is seeing signs of what she thinks might be autism, as my child can be really inflexible. Is this something I should be concerned about?
It sounds like what your teacher is saying is there's differences in the way your young person is existing in the world that might be making it challenging. If we remember from earlier on what autism is, preference for sameness or being inflexible is one of the hallmarks. So it's thinking around that broad thing. And I think learning more around your child and labels that may or may not fit is often useful. I often have conversations with parents and caregivers who say, well, what's the point? It's going to hurt them. The point is helping other people understand them and explaining this is just the way that your brain works. It's not a problem. It's just the way your brain works, and we can work together on working on that. And it adds to something I was hoping to say earlier is sometimes people will refer to neurodivergence as a superpower, and there are certainly really great elements to it, and it can be exhausting having a superpower sometimes. And a superpower just refers to, in autism, sometimes there's differences in memory and thinking, and there's lots of great questionnaires that you can ask your paediatrician around strengths-based that comes from neurodivergence as well as the differences. But the differences still make it hard. It's not just I have a superpower and I'm indestructible. It's still really hard. Clark Kent still had a tricky life because he's living being a superhero lots of the time.
Yeah, that's right. And I think sometimes we hear that the superpower really is actually understanding, the way your brain works and where your differences and strengths are and being able to, use that to navigate things to the best of your ability. And that's the real superpower. So that's where having people around you understanding what's happening or around your child really does offer them the best chance of, thriving.
Exactly, and it might relate to your young person might ask you that people are saying I have autism or I'm autistic, and maybe that's true or not. And parents sometimes wonder, when is the right time to tell my child if they do have autism? I often think the time when your child is asking questions and noticing things are different can be a time to have a conversation, and that's a good one to have a chat with your paediatrician about.
Absolutely, and taking the lead of your child is a really great way to go about that. Moving on to another aspect now, one of the things we have enjoyed doing in this podcast series is busting some myths about some of the common behavioural challenges we see out there. So thinking about autism, what's one of the things that you hear a lot that you think, oh, that's just not true, I'd like to set the record straight?
I hear it from lots of people that everyone is just being diagnosed with autism these days. You know, back in my day, this was just the way boys worked. It kind of suggests that the prevalence of autism is increasing, to which the answer is technically yes. I think it's more relating to the fact that we're getting better at noticing what is autism and what isn't autism. I often think around, before we had really powerful telescopes, we thought there were only a set number of stars in the sky. Now we have better telescopes, we suddenly have more stars in the sky because we're getting better at noticing where they are and what's going on.
But they were always there.
But they're always there, and it's always a thing.
Yeah, great. That's a really, really powerful way to think about it for people.
Thanks.
So many useful tips and insights from you today, Toby, and some great advice for parents at home listening. We'll put some links in the chat, in our show notes, to those different resources that we've talked about today, as I'm sure parents have lots more that they'd like to unpack and understand in their own time. Thanks again for joining us.
Thank you. Thanks.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.